Hi again. Uh, my name is Mauricio Neuber. I am the coordinator of the research group Complexity, Hypnosis, Subjectivity, and Semiotics. And I am professor at the University of Brasilia, Brazil. In following our discussions on hypnosis and chronic pain, I'd like to introduce a very interesting subject in which chronic pain is considered as a semiotic system and as a subjective system. And this idea is very relevant to consider why hypnosis is important and relevant to treating chronic pain. And we have perhaps three main consequences in this sense. The first consequence is that when we consider chronic pain as a subjective and semiotic process, we do not mean causality. For example, I will not say that the experience somebody is suffering from an oncological situation is a psychological cause. No. We only means that chronic pain is experience. As my colleague Rodrigo Rizzo is publishing currently, when he makes the difference in the cause, the transmission, and the experience. So chronic pain is a subjective experience and a semiotic experience. And in this sense, as it an experience, it's capable to be influenced by another resources which are present in human subjectivity and in human relationships. And in this sense, we can observe in quotidian life, in everyday life, many examples when a patient knows the physician will be there to treat him. He probably will have a peace condition in himself that possibly will affect positively the pain experience. When person has, as I observed, financial security, considering a specific problem, I observed many cases in which the chronic pain simply decreased. An emotional problem which will be solved frequently can help people to deal more appropriately with chronic pain. So there are many examples in this sense. And as I said, it's not a causality, but a question of influence. And hypnosis is also a matter of influence. Because when the hypnotherapist help somebody through the way of relationship and the techniques, he is fostering influence methods to treat some problems. the second consequence in this sense is that this system requires an indirect form of approach, as well developed by Milton Erickson's therapy. And what does it mean? Does it mean that chronic pain, as well as many other forms of symptoms of experience, do not deal in a good perspective, in a good way, with orders? So the idea, somebody says, the chronic pain will decrease. Your chronic pain will decrease. Your leg will feel now an allevium. Your chronic pain, the chest, the head will be eliminated. The direct prescription is commonly addressed to conscious systems, to the subject's ego, to deliberateness. And chronic pain frequently is organized, or if you want, configured in unconscious dimensions, or if you want, in systems which are not directly related to deliberated control. So, what is perhaps one of the most significant contributions of Erickson's work? To access these systems, we can tell an history, use metaphors, playing with words, and establish a context, for example, a dramatic context, in which, instead of trying to translate my intention or to explicitate my intention, we only act, because acts are also modes of transmit messages, especially in a symbolic level. And the third topic we can consider is that the therapist is above all a kind of navigator, somebody who conducts the boat, then rather than somebody who can control the ocean. So it implicates a very significant topic in which the therapeutic process requires modes of partnership. A partnership with the conscious, with deliberateness, and especially a partnership with other semiotic systems related to chronic pain, to specific pain, but also with many forms of resources people have, which are developed in the personal history, but also in a phylogenetic dimension. Thank you very much. Bye-bye.